Hi, my name is Bhatia Elbaum. I'm a professor in the School of Education and Human Development at the University of Miami. The study I'm going to describe in this video is entitled Empirically Identified Subgroups of Children Served in Part C Early Intervention Programs. The study was co-authored by my colleague, Shanice Chilimini Aksoy. Early intervention programs under Part C of the Individuals with Disabilities Education Act, or IDEA, serve a developmentally heterogeneous population of infants and toddlers ages birth through 36 months. Some of these children have conditions such as Down syndrome or cerebral palsy that are known to be associated with later developmental delays or disabilities. Other children have delays of unknown etiology. Some children show delays in just one domain of functioning, such as communication. Others show delays of varying degrees across multiple developmental domains. The main purpose of our study, then, was to see if we could describe this heterogeneous population in a parsimonious and clinically useful way. Our study sample included over 1,500 children who received early intervention services in Miami-Dade County, Florida. The data we used were children's developmental assessment scores in 5 domains: communication, cognitive, motor, personal social, and adaptive. The assessments were conducted when children entered the early intervention program and again when children exited the program, typically around 36 months of age. To address our main research question, we applied a statistical technique called mixture modeling to developmental assessment data from the assessments done when children entered the early intervention program. We found that the children entering the program could be classified into 4 distinct subgroups. Here's a depiction of the first 2 subgroups' developmental profiles as defined by children's mean developmental assessment scores in the 5 assessed domains. The first subgroup, which included about 47% of children in the sample, shows a severe delay in communication, somewhat less severe delays in the cognitive, adaptive, and personal social domains, and relatively stronger functioning in the motor domain. This is a pattern characteristic of many children with developmental or specific language impairment. Interestingly, this subgroup included the majority of children in the sample with suspected autism spectrum disorder. The second subgroup's profile is parallel to the first group's, but across domains, their mean scores are all about 10 to 15 points higher. This group, which comprised about 15% of the sample, included most of the other children who had suspected autism spectrum disorder. Here are the profiles associated with the other 2 subgroups. We note that children in each of these 2 subgroups show delays of comparable magnitude in the communication, cognitive, and motor domains, with higher scores in the adaptive and personal social domains. The more delayed of the 2 subgroups included about 30% of the sample. Most, if not all, of the children in this subgroup would likely be characterized as having global developmental delay. The less delayed of the 2 subgroups, which included just 7% of the sample, had scores in the communication, cognitive, and motor domains that indicated milder delays, with typical or near typical functioning in the adaptive and personal social domains. Though we did not use age as a variable in the mixture modeling analysis, the 2 sets of subgroups I just described differed significantly in terms of the age at which children entered early intervention. Almost all the children in the subgroups with the more discrepant profiles entered early intervention when they were over 1 year old. In contrast, over half the children in the subgroups with more level profiles entered early intervention before they were 12 months old, most likely on referral from a neonatal intensive care unit, pediatrician, or other medical professional. We were also interested to know whether children's developmental trajectories differed by subgroup. This turned out to be the case. Children with this developmental profile were significantly more likely than those in the other 3 subgroups to show persistent delays rather than improvement in their developmental functioning. Indeed, 75% of children with this initial developmental profile showed persistent or worsening developmental delays. Within the subgroup with the most positive outcomes, about 45% of children showed persistent delays, while 55% showed a lessening or, for some children, remediation of their delays. Our Our study has several important implications for both clinical practice and research. First, professionals' knowledge of the relative risk of persistent delay associated with different entry profiles could inform conversations between professionals and families concerning the outcomes their child might achieve and the likelihood of ongoing need for services and supports. Second, knowledge of the relative percentage of children who present with these distinct profiles and the likely developmental trajectories of children in these subgroups could inform service planning at the state and local program levels. And finally, the identification of subgroups characterized by distinct developmental profiles provides insight into underlying commonalities among children with different presenting diagnoses when they enter early intervention. These commonalities can inform future research on the impact of early intervention services on children's developmental